Thank you for joining us tonight as we host a virtual town hall on the coronavirus pandemic's racial divide here in Milwaukee.
Over the next half hour, we will be speaking with health experts and business leaders from the community about the medical, economic, and emotional impacts the virus has had on the African American and Hispanic communities.
We will also look ahead and try to answer this question of how will we come out of this pandemic stronger and be in a better place once it is all over.
So let's take a look at the numbers in Milwaukee County. First, the breakdown of demographics. The county is made up of more than 50% Caucasian, 26% African American, and more than 15% Hispanic.
Now that we know the demographics, let's look at the confirmed cases by race. Nearly 1,500 of the 3,685 cases in Milwaukee County are African American. That's 40%. 828 cases are Hispanic, and that equals 23%. 56% of the deaths in the county have come from African Americans and Hispanics.
So statewide, there are more than 9,200 cases, 374 deaths, and more than 93,000 negative test results. So let's begin tonight talking about the medical impact the virus is having on the African American and Hispanic communities.
Joining us is Dr. Heather Parody, who is the Deputy Commissioner of the Milwaukee Health Department, and Dr. Tito Izzard with the Milwaukee Health Services.
Thank you both for being here. Dr. Parody, let me start with you. When this virus started spreading from person to person in the city, it really became a game changer. So why did it strike so fast, so deadly in the Milwaukee African American community?
Good evening, and thank you for having me. What we understand about our communities that are experiencing the COVID virus is that oftentimes the individuals that we're seeing who are most affected, we know that disparities exist in their underlying health status and health conditions. And so we believe that this is likely a contributing factor to both the infection rate as well as the unfortunate death rate that we're seeing.
All right, this is a viewer question, and I'm going to direct this one to Dr. Izzard. This is from Mirtha S. of Milwaukee. Please comment on the way that Milwaukee's racial history is unique in exacerbating the disparities we are currently observing in our COVID-19 numbers.
All right, well, thank you for having me today. When we look at health disparities, really, when we examine things, it's really an economic driving condition that leads to the disparities we actually see in health. So whether you're talking about all the components of what we call the social determinants of health, whether it's nutrition, whether it's access to healthcare, whether it's education, employment, whether it's the wealth position, it's actually your wealth position that stabilizes you, not your income. So the lack of economic inclusion in Milwaukee in particular, but in the United States, has allowed African Americans to be relegated to a permanent underclass. So when we look at issues such as housing, and we look at redlining and the historical impact that that's had, look at where the majority of African Americans and the majority of Latinos live in the state of Wisconsin, let alone in the Milwaukee area. And you can see that a lot of these issues are economically driven. So when we start thinking about the contributing factors to disparities as specifically related to COVID-19, we can also see that multi-generational living plays a big role because people have to live together, grandparents taking care of small children, and you have asymptomatic carriers that may bring it into the household, and then someone else can become impacted or infected. So it really is an economic issue that has to be addressed by creating what I've referred to as restorative health equity.
Yeah, we're going to address some of those economic issues in a few minutes. But Dr. Parody, we do have a question from a viewer, and it addresses chronic health conditions. Let's listen in to Jackie.
Hi, I am Jackie. I'm from Milwaukee. And my question is, what are we telling people in the Black community who they have chronic health conditions that need to be managed, and they're afraid to go to see their doctor, or they're not in contact with their doctor? What measures are being done to address that?
So Jackie, thank you for your question. And certainly during this pandemic, Many in the medical community have shifted practices. So trying to continue to manage chronic conditions either telephonically or through virtual visits so that individuals can remain safe in their homes, but still have the ongoing medical care that their conditions require. As you're probably aware too, there's a general recommendation that anyone who has to go out in public, especially when they know that they're not going to be able to social distance, should wear a face mask or a soft covering over their mouth and their nose. And we are seeing some shifting of medical services to start to reach out to individuals to bring them back into care, those individuals who may not have been able to connect through other means during the past 8 weeks. We're also really trying to get individuals who are experiencing symptoms that they think might be consistent with COVID, even mildly affected individuals, to seek testing. Testing is becoming much more widely available, and to really understand the full impact, we need to get individuals tested. So we're really encouraging anyone who thinks that they might be having symptoms to reach out to their regular provider, or if they don't have one, to please call 211.
Great segue to talk about testing. It still seems to be a little limited, Dr. Izzard, as well as tracing. Mayor says that 600 tests a day is where they want to be. Mobile testing, instead of waiting for people to come into the clinic, do you think that's where we need to go?
Well, right now, the federally qualified health centers have expanded their testing over the last week or so to make sure that anyone that has symptoms can get tested. And there's a community health center probably within 5 minutes of where you are. So we always encourage people, if you don't know where your local community health center is, you can call 211 and they will provide you with the information so that no one who has symptoms can or should be denied access to quality health care, which would include COVID-19 testing. As a larger community, we're trying to ensure that there's enough PPE as well, personal protective equipment, as well as the testing materials available so that a larger group of people can be tested, whether they're symptomatic or not. And so right now there's a lot of expansion of that. And so we have to pay attention, really it's changing on day to day as far as what the testing availability may be. But without a doubt, if you have symptoms, you can get tested. Call your primary care doctor first. But if you are uninsured or don't have a primary care provider, your federally qualified community health center near you will test you.
Dr. Parody, we just have 30 seconds left. Give me your sense, 3 to 6 months from now, are we going to be in a better place if there's not a second wave or another surge?
I surely hope that we will be in a better place. Worry about a second wave or a second surge is a real concern, and a lot depends on how we act now. The plans that we take as we gradually reopen our society and expand services such as testing to fully understand the illness and its prevalence in our community.
Sorry, I didn't mean to cut you off. This was a great way to start the conversation. Thank you both for joining us this evening. We appreciate your expertise and your thoughts.
Yes, and don't go anywhere. Next, we will talk about the economic impact the virus is having on these communities. Welcome back. We just touched on the health and medical impact the virus is having on the African American and Hispanic population.
Now we're going to take a deeper look at the economic impact COVID-19 is having. And joining us are Nancy Hernandez, president of the Hispanic Collaborative.
And Ozzie Kendrick, president of the African American Chamber of Commerce. Thank you both for joining us.
Ozzie, we know that COVID-19 has been devastating to family-owned businesses, entrepreneurs, and more than 500,000 workers who are now unemployed in Wisconsin. What are some of the unique challenges minority-owned businesses are facing in this pandemic?
Thanks, Shannon. There's several unique challenges to minority-owned businesses. I think the first hurdle begins when minority-owned businesses really start their business. They begin with very little cash reserves. They're very independent, so there's some difficulty securing bank loans, other financing, and a number of minority businesses are sole proprietors, which may make them ineligible for most small business loans. So it's safe to say that minority business owners don't want government around too much. So they don't apply for federal loans. So then when the federal stimulus dollars through the CARES Act, which are intended to really be a lifeline for small businesses through 2 loan programs, minority business owners are reluctant to reach out. They may have weak relationships with banks, sorts of great things, despite the talks that the loans are forgivable if the funds are used for the approved purpose, such as rent, utilities, business operations. It's still a hurdle.
So let me just follow up on that. So where can they find those resources if they're reluctant to use the ones that might be available?
There are a number of resources in addition to those that are available. The Wisconsin Economic Development Corporation is coming out with a ethnic minority grant program that will begin next week. The African American Chamber has a recovery fund that will begin also next week. And then there are a few organizations, nonprofit organizations that have grant opportunities. List Milwaukee. All of those opportunities are available on our website at aaccwi.org on the COVID-19 business resources.
Excellent resources. Nancy, I want you to listen to a question from our viewer.
Hi, my name is Marisha Harris, and I am from Milwaukee. I have read articles about the exploitation of essential workers, specifically grocery store workers who are predominantly people of color. How are our current economic development and workforce development strategies pivoting to better serve our communities during the post-COVID-19 recovery phase?
I think that's an excellent question. And, if we look at even just the Hispanic workforce here, 80% of the Hispanic workforce is in 4 industries: food prep and food service, production or light industrial, building and grounds, and farming, fishing, and forestry. So you can imagine not too many of those jobs that I just mentioned in those industries can you work from home. And so you've got a double-edged sword. You've got certainly people of color and Hispanics making up a lot of the essential workforce out there, and being in those situations where they are exposed to COVID-19. But those are the industries that are hardest hit by COVID. So 20% of Hispanic workers, according to the Washington Post recent poll, are hit in terms of layoffs. If you also look at some of the Pew studies, 30% of Hispanic households are dealing with a layoff, and another 40% are dealing with reductions. So just in terms of numbers, 35,000 roughly Hispanic households in Milwaukee County, and that means close to 30,000 of them, 28,000 to be exact, are dealing with some type of financial crisis. So much like in the African American community, Hispanic average household income is about $10,000 behind that of others of the general market within Milwaukee County. And it also has more people in that household. All of that really spells for financial disaster without creative and targeted solutions to help these geographies, both with an influx of emergency dollars right now, understanding especially in the Hispanic population, we have segments of the population that have no access to federal funds, as well as long-term strategies to help create more diversification in terms of occupancies and get them access into more training to get into better paying jobs, which really meets the demands of the workforce needs in our region. So it is creating a win-win if we can do those things, but we need to be creative and we need to put resources in place to be able to do that in our communities.
So let's talk more about that, Asi. When you look for the next 3 to 6 months, when you look about reopening or rebounding, what resources are needed? What is available? How do you go forward from here?
I think there's an immediate need for recovery assistance for minority business owners, and that will predominantly be through grants. As a nonprofit organization, we've transitioned to be a virtual organization within a couple of weeks, but that wasn't easy to do for all small businesses, and many of them have closed their doors. So to recover and reopen, there'll be a need to provide some assistance for things like inventory, ramping up employees to reopen their doors. So putting some funds in payroll, rent, utilities. The African American Chamber is currently raising funds for a recovery fund, but it's not enough. The WEDC has a minority grant opportunity, but again, that's not enough. There continues to be an opportunity for the community to support the reopening of minority-owned small businesses through a grant experience, an opportunity for them to recover and go back to business.
I think support will be key for those who are able to support economically as well. I want to thank both Nancy and Aussie both for joining us today. We're going to now focus on the psychological toll that coronavirus 19 is having on us all.
We'll be back in 60 seconds.
All right, coping with COVID-19 is taking a toll on us all. The news of high infection rates, the images of loved ones lost to the virus, and social distancing can have us all feeling hopeless and sometimes isolated.
Yeah, not just today, but in days to come as well. So joining us right now is Dr. Maria Perez from the 16th Street Community Health Center and Tammy Rivera of the Southside Organizing Center. And Dr. Perez, let me begin with you. So I'm so glad that you're able to join us. I know that you have a COVID team at the 16th Street Clinic responding to this crisis every day. And I understand you're getting anywhere from 2,500 to 4,000 calls a day. What kind of questions are you getting on the medical and mental health issues?
Well, we are getting a lot of callers on a day-to-day basis, really needing a lot of reassurance, as well as just basic information, because I think there's a lot of myths out there. So many callers are calling in to get basic information about the nature of the virus itself, the nature of the pandemic itself, reassurances around how to best help their families. And, not only from a medical perspective, but certainly from a behavioral health perspective as well.
Tammy Rivera, this is a question from one of our viewers, Sharon W. She asks, health and economic disparities for Black, brown, and poor people have been an issue for far too many years. Now with COVID-19, there's no denying that these and other disparities exist. What needs to happen, though, on the federal, state, and local levels to address this so that it doesn't continue to be business as usual?
Well, first and foremost, our residents have seen how they're responded to during this pandemic. And we focused a lot of our energies and times right now on helping folks to understand civic engagement, how important their voice and their vote is during this time. And if that they were happy with what took place during this time, they want to make sure those folks get reelected. And if they're not happy, to make sure those folks get replaced and to monitor their elected officials, legislation, budgets, etc. What needs to happen now is after the exposure of how unprotected folks are and how self-interested so many of our leadership bodies are, that we really need to hold them accountable and ensure that those disparities get addressed in these next cycles at all levels, at the federal, at the state, and at the municipal level. So community engagement, grassroots response, now with all this trauma and disappointment needs to be turned into action from the masses.
Yeah, Dr. Perez, this has been hard on so many of us, but seeking mental health still can be taboo in many minority communities. So how are the images, the changes of life as we know it, what kind of impact is that having on the community members that you are in contact with every day?
That's a great question. We know that psychological stress tends to be higher in low-income populations in general, and we know that that's true of our Latino friends and families as well. So I think that there's a relationship between socio-economic status and psychological factors. We are certainly seeing an increased rate of depression and anxiety among our existing patients, as well as the new callers that are calling in to access behavioral behavioral health services. As with many entities across the state and the country, we have moved our behavioral health and our medical teams. We have medical teams in clinic, but our behavioral health teams are working with telehealth. And so that has been a unique challenge because we're talking about a group of people who are not accustomed to accessing help for psychological distress, much less in a telehealth platform. So it's true that Latinos don't access mental health services just under normal conditions, but now we've got it layered with the added barrier of telehealth. So we're also finding that we are needing to coach our Latino friends and families in our community so that we can teach them how to use telehealth in the similar way that we're using Zoom right now as a platform, for example. I know we're reaching out to a lot of our families and friends with telephonic telephone calls, and they certainly are appreciative of that. They're really finding a need to stay connected. And I just want to say one thing about the Latino population in general. Latinos are highly affiliative with extended family, and social distancing has been really devastating to many of our families because connection with extended family and community is one of the resiliency factors in Latino populations, and social distancing has not made that easy.
A definite great way to segue, because I wanted to talk to Tammy about that as a community organizer and helping our viewers kind of understand, while we're all being asked to do what is necessary to flatten the curve of COVID-19, how that really is kind of counterintuitive to the Latin culture.
It is absolutely opposite of what we hold in our value system of family and community. We're an interdependent family and community, a multi-generational. When there is trauma or need, we group, we collect, we resolve things collectively. It is a natural instinct and tradition of immigrants, which Milwaukee is highly comprised of, and in particular on the South Side, to huddle in times of need, to gather in faith communities. None of that can happen. And so it is a compounded effect of trauma and stress, sadness, and depression for all of those reasons.
And again, when you say you no longer have the community to gather in the church or to be able to gather together because we're trying to make sure that we're distancing ourselves and not spreading, this can be a difficult challenge.
It is. And so we have activated a whole new set of digital organizing techniques to create that community and education. We're on every day now, Monday through Friday at 3 o'clock Facebook Live, in order to create that sense of community, to raise up the positives that are happening, to combat the isolation and the negative, and to give people some options on how to get their information, resources, and how to take action during this time.
Can you say that Facebook page again so that those who may be listening?
You can be with us every day, Monday through Friday, 3 o'clock with SOC on at Facebook, and we go live every day. And they can go to our website and get that information at socmilwaukee.org.
And Dr. Perez, if you can give us a couple quick resources for folks to turn to.
Sure. If I wanted to also point out, and Tammy, your comments are so spot on. So in terms of resources that our communities can reach out to, we have the Parents Experiencing Stress, the confidential helpline. They can call that line at 414-671-0566. I know that there's a teen.
We'll have to leave it at that. We'll have to leave it at that. So we will post more information online. Thank you both very much for joining us.
And we'll be back in 60 seconds. All right, we learned a lot in this 28 minutes on how the racial divide is impacting us here in Milwaukee and COVID-19. I hope there were some takeaways.
Yeah, we appreciate that you're watching. We also want to let you know we encourage you to sign up for our daily coronavirus newsletter. We send it out at 3 p.m. Just head to tmj4.com/newsletters to register.